right. Hello, everyone. My name is Cordetta Davis, and my clinical disorder will be on central anemia. Kind of lost my voice a little bit, but please just bear with me. All right, so just a little background what is central anemia. It is an inherited disorder. It is actually caused by a defect in the urea cycle. It actually causes this actually all causes the ammonia and of course other toxic substances to accumulate in the blood. It's missing that enzyme, which I will get into in a little while, that's causing it not to be broken down, and there's that buildup causing health problems. It is categorized as a rare disease, and there are two different types of it. So as you can see in this picture, a normal person versus a person with central anemia. You can see that enzyme, that ASAS enzyme, is what's breaking down the ammonia. But a person with central anemia doesn't have it. They're missing it. So there's that buildup of the ammonia causing all of these problems. All right, so on to the first type. The first type is known as classic central anemia or the CTLN1. It is a rare autosomal recessive genetic disorder. That's my roommate. There's four types. There is a neonatal acute form. There's a milder late onset form. There's one that begins during or even after pregnancy. And then there's also a asymptomatic form, and it's caused by the deficiency or the absence of the enzyme arginosuccinate. As you can see, you see the citrulline, it's being condensed with the aspartate and it's forming the argininosuccinate acid. It also causes hyperammonemia and also can cause intellectual disability. So on the type 2, it's known as the CTLN2 or the adult onset. Of course, as I said, causes hyperammonemia, stupor, coma, and also sudden behavioral changes, and it appears between the ages 20 and 50. Okay, so some facts about the CTLN1 symptoms: poor coordination, slurred speech, and sleepiness. You can't really diagnose a disease like this because it's so rare, but one thing they do use is a newborn screening, which has these things called ACT sheets, which are actually used to keep track of the results of the child. Let's say they're negative results, but next time there's a positive results, you can be like, okay, next time there was these, so what happened? What caused it to be positive then? Really, they only use, I mean, it can happen for children too, but they really start out doing the newborn screening for babies and then move on to the ACT sheets like once they get a little older, so they can tell like maybe there needs to be a change here or what. Inheritance, as I said earlier, it is an autosomal recessive pattern. And the phenotype is really referring to this picture over here. We're seeing that both parents are carriers. There's that 25% this child that has the condition. There's that 50% they're carriers but will be unaffected. And then there's that 25% that's unaffected and is not a carrier. So we can actually see that this, with the parents being homozygous, that this is less dominant because it's only 25%. So let's just say the dad is Punnett square wise, big R, little r, mom, both little R's, you're getting 50-50. So that's just showing that them being heterozygous is being more dominant. Then a lifespan, really you can live a long life with it, but the longest survival rate of an untreated infant was 17 days. Okay, so affected groups, infants, it can really happen at any race. The liver and the brain are the organs that are affected because the liver, there's that buildup of that bile, can't flow. Then the brain, you're having seizures, being in comas, all that damage being done. You can see the different type of treatments, but the main one that I liked was dialysis because I didn't know that dialysis could help with this, but it makes sense because it's actually helping to clear that ammonia and other toxic substances from the blood. It is caused by mutation in the ASS1 gene because that gene is mutated. It can't break down that enzyme and it's causing the buildup of ammonia. And then the incident is the most common form of central anemia, and it affects 1 in 57,000 worldwide. Symptoms for part 2, seizures, coma, loss of memory, and of course, diagnosis is the newborn screening. Inheritance, same as the first one, just happens later because it's the adult onset form, and it occurs equally in men and women, no matter their race. But I was doing some research and it is saying that for both types, they were most prevalent in East Asians, mainly the ones who have hyperammonemia or neuropsychiatric disease. And of course, the same 2 organs are affected. Life expectancy can still live a long life. Phenotype really depends on the parent, like I said. If they're heterozygous, it's going to be more dominant. Treatment is a high protein and low carb diet. And then the mutation is happening on the SOC25A13 gene. Let's see. Yeah, that's right. And then the incidence, it varies. So some findings, of course, if these patients were able to have that liver transplant, it would cure the hyperammonemic episodes, but with the brain, all that damage is done, it won't be reversed. So there still be something going on, even though the liver is helping with the bile and those episodes, you still could have seizures, you still could be in a coma, you still could have neurological breakdowns, anything. Just like a normal person, you can have normal growth and development. And depending on which type you have, signs and symptoms resolve on their own. And just like I said, I'm just now learning about this. Health professionals are still learning about this. We're still researching. We're still trying to figure out what can we do. And these are my references, and that concludes my presentation.